Regional Institute of Medical Sciences (RIMS) has achieved significant medical breakthrough by successfully performing its first ever video-assisted thoracoscopic surgery (Vats) decortication, a minimally invasive thoracic procedure on a critically ill patient. The complex operation was conducted on May 6 on a 40-year-old male patient diagnosed with stage 3 multiloculated empyema thoracis, a serious condition involving pus accumulation in the chest cavity that had trapped his right, middle, and lower lung lobes. The case was further complicated due to dense adhesions and the patient's history of cerebral palsy and recent recovery from dengue fever. The pioneering surgery took place in the state-of-the-art modular operating theater of RIMS Cardiothoracic and Vascular Surgery (CTVS) department. The procedure was led by Professor T.H. Chito, with anesthesia team headed by Professor L. Pradip Kumar. This landmark procedure followed another successful VETS operation performed at RIMS on April 24, in which a 50-year-old male patient underwent removal of intrathoracic tumor. Director of RIMS, Professor G. Sunil Kumar Sharma, lauded the surgical and anesthesia teams for their coordinated efforts.